Well, welcome everyone, and thank you for joining our webinar today on mass incarceration and public health. My name is Sophie Teague, and I'm the Senior Marketing Manager for Public Health and Health Administration here at Jones & Bartlett Learning. For those of you who are not familiar with Jones & Bartlett Learning, we are a provider of instructional, assessment, and learning performance resources for the secondary, post-secondary, and professional markets, and we specialize in the areas of health and safety. So now let me introduce you to our featured presenter, Dr. Patti Rose. Dr. Rose earned her master's degree from Yale University, followed by her doctorate from Teachers College at Columbia University. She has served as a faculty member from adjunct professor to instructor to the associate professor level at the University of Miami, Florida International University, Springfield College, Worcester State College, Nova Southeastern University, and Barry University. In recent years, she's developed courses and taught courses including Black Women in Medicine and Healing, Psychosocial Health and Healing in Women, Race and Healthcare in America, Culture, Race, and Diversity Issues in the United States, Mass Incarceration and the Impact on the Black Community, and Black Women in Medicine and Healing. She's the author of several books, including Cultural Competency for Health Administration and Public Health, published by Jones & Bartlett in 2011, as well as Cultural Competency for the Health Professions, also published by Jones & Bartlett in 2013. So with that, I am now going to hand the reins over to Dr. Patti Rose. Dr. Rose?
Thank you so much, Sophie. I really appreciate that. And I'm really delighted to have this opportunity to speak to everyone about such an important topic. We're going to be talking about mass incarceration. So although this is not an enjoyable topic at all, in some ways it is one of the most critical issues that we're experiencing in the United States today. So I'm going to get us right into this dialogue. First of all, the U.S. is the most incarcerated country in the world, as there are more Black men under correctional control today than were under slavery in 1850. This was actually a quote from John Legend at the 2016 Academy Award acceptance speech. And I think it's important to use that quote because it helps us to understand that this has just gone beyond pedagogy and books and research and so forth, but it is now understood in the entire population as a real issue, and therefore one that we need to pay close attention to. So the first question that I have, and this is a question that I'm just going to throw out there and then I'm going to move forward rather than seeking an answer at this time, but I want you to think about it. Do you agree with the perspectives offered by these artists? Because there were more than one artist at that event who spoke about this issue. And how would you approach this subject matter in the classroom? So for those of you who know the artist Common, he also brought this up at the Academy Award. Let me give you an example. Let's start this off with a very serious example. There was an uprising in Texas, and it was recent at Willacy County Correctional Center. Why? Because in this correctional facility, the prisoners were experiencing overflowing sewage, solitary confinement, as well as poor medical care. And they were incarcerated for a number of reasons, some for drug convictions, others for crossing the border without a visa, and unlawfully reentering. So normally in these cases, individuals would be deported, but the scenario these days is to actually incarcerate them rather than deport them. So this is immigration prosecution. So an author entitled Carl Takai, who is an attorney, an ACLU attorney, which is the American Civil Liberties Union, he worked on a report entitled Warehoused and Forgotten, Immigrants Trapped in Our Shadow Prison System. So this is a prison system that's sort of behind the scenes. Not everyone is aware. We're becoming more aware of late, but not everyone has been aware of these types of prisons. But our taxes are used to imprison human beings, so we need to be aware. There's a universal sense of despair in these prisons because they are actually deplorable. In the prisons, we find inadequate health care, So because this dialogue and my book itself is focused on healthcare, I'm going to move there. But before doing that, let's think about their living quarters. I mentioned the raw sewage already. The inmates' clothes were washed with mops and cleaning equipment. They were placed in the hole, which is another word for solitary confinement, which I mentioned. And sometimes solitary, which is a very unpleasant, deplorable situation for a person to experience, especially over long periods of time. Sometimes being there drove the prisoners to hurt themselves or to attempt suicide. In terms of health care, basic medical care, for those prisoners that complained of a toothache, the only treatment was extraction. For inmates seeking diagnosis from medical staff, for illnesses, sometimes very severe illnesses, they were only handed Tylenol and then sent away. So if we look at this organization called Horizon provides correctional health care. It is the leading provider of correctional health care services in the United States. If you look at this link when you have the opportunity, you can learn a little bit more about Horizon and their provision of health care to prisoners. This brings us to the notion of prison and money, prison profiteering in terms of health care. It's a business model. Less care, high profit, people get sicker, Horizon makes more. One of the nurses at Horizon, this is her quote that you see in the box in the slide. This is what she stated, Nurse Diane Jackson. "We save money by skipping the ambulance and taking prisoners directly to the morgue." Horizon has been sued 660 times at the time of the writing of this particular presentation, so it could be more at this time. That's one of the ways they generate an estimated $1.4 billion every year. So clearly we can see that money is being made. At the bottom, once again, there's a link if you want to go and take a look at that information further. Healthcare, as many of you are probably aware, is a hugely profitable business. As long as Horizon is motivated by its bottom line rather than the health of prisoners, there will always be a perverse incentive to not provide treatment. So this is true for the provision of health care in and out of the prison system, because whether we're talking about prisons or not, in terms of health care, there's a business incentive, there's a bottom line. As one who has served as a vice president of a healthcare organization, a community health center, as well as a vice president, president and vice president, both administrative roles, I was able to see with my own eyes that there was a focus on the bottom line, money, as a key issue to making sure that individuals are served. This is also happening within the prison system. Prisoners have to pay for their health care in the prison, often taking out loans within the system to do so. So how do we solve prison profiteering? First, we need to take the profit incentive out of healthcare in general and in prison. In my book, I discuss some of the salient issues that are being discussed today, such as Obamacare, should we keep it, should we not keep it, how should we change our current healthcare system, and I'm using air quotes when I say system because to use the term system when we talk about our healthcare is not probably the best way to go. So how do we solve this problem? It's very, very complicated. But the first thing that we have to do is take the profit incentive out. As expressed in my books, you can see that there are a couple of my other books listed there. One is Cultural Competency for the Health Professional, and the other is Cultural Competency for Health Administration and Public Health. I talk about this notion of making sure that health care is provided in a culturally competent way. Between 2040 and 2050, it is expected that what we consider to be minority populations in the United States will be majority populations in this nation. And so we have cultures, many, many different diverse cultures, and their needs need to be addressed. It's a skill set to be able to do that. So within academic curriculum, particularly in terms of healthcare, within the area of health administration, public health, and even those individuals who are providing care, all of the healthcare practitioners need to understand the importance of cultural competency so that we can make sure that people's needs are being met. What are some of the additional solutions? We need comprehensive oversight of entities offering correctional health care. So if we have mass incarceration in our nation with so many human beings imprisoned in American society today, it behooves us to make sure that there's government oversight, there's oversight from advocates for human beings who are being provided with health care in our nation, and et cetera, to make sure that they're served properly. There also needs to be permission for family members' involvement in ensuring the rights of their incarcerated loved ones in terms of health care and beyond, because sometimes family members don't have any opportunity to say anything about what is happening to their loved one. It could be a mother with a child that's in prison. It could be any person who has a loved one that's in prison. So the provision of optimal health care to all is indeed a human right. Now, I want to move now to talk about the school-to-prison pipeline, because so far I've been talking mainly about adults. But the reality of the situation is that we are in a society in which schools are putting children in a situation based on behavioral scenarios that they are being arrested from the school building and put into the criminal justice system. So, for example, if we take a look, we'll start with suspensions. Black boys are suspended 3 times more than white boys. Black girls are suspended 6 times more than white girls. If we look at an intra-gender comparison of suspension rates, 2% for white girls, 12% for black girls. So here we can see a tremendous disparity in terms of those suspension rates. And we'll talk about why that matters. How did this start? First, zero tolerance has resulted in black students facing disproportionately harsher punishment than white students in public schools. So black students represent 31% of school-related arrests, and students are suspended for a discretionary violation are nearly 3 times more likely to be in contact with the juvenile justice system. So there's the connection. Children who are suspended from school oftentimes are at home, they're idle, they don't have anything positive to do with their time, they feel very bad about themselves, they're disconnected from their peers and from their teachers and so forth. And so they're more likely to then come in contact with the juvenile justice system. And for the prison profiteers, this is a great thing, but for the children, this is horrible that it's happening to them. There was actually a study released by the NAACP, and there is a link because I would love if you would go and take a look at this article because it's mind-blowing. It's entitled Misplaced Priorities, and it tracks the steady shift of state funds away from education and toward the criminal justice system. So these methods of over-incarceration most often impact vulnerable and emerging majority populations. So let me just take a moment to tell you why I'm saying emerging majority. I don't use the term minority anymore. And the reason why is because the communities of color in America, as I mentioned earlier, between 2040 and 2050 will become the majority populations in the United States. And so consequently, why use the term minority? This has already happened in certain locations. For example, in Baton Rouge, one of the individuals that I interviewed in my book is an LSU professor, and he pointed out that in Baton Rouge, this scenario that I'm describing of emerging majority being, the majority and whites being the minority have already happened. That has already taken place. So what do we have to do? We must stop the school-to-prison pipeline. The fact that we even have to have a discussion about it is mind-boggling, but we do because it's happening, and we have to stop it. How do we do it? We can do it in a very common sense way. It has been done. Robert Runcie said, he is the Broward County School Superintendent. I live in Florida, and so in Broward County, this happened. He stated, "This was a historic day for ending the schoolhouse to jailhouse pipeline." What is he referring to? He is referring to the fact that his board unanimously voted to sign new rules meant to drive down arrests of children. It promises appropriate responses and use of resources when responding to school-based misbehavior. So school discipline practices that channel fairly inoffensive young people into the criminal justice system is what he is referring to. When I was young, if you got in trouble, you went to the principal's office or the guidance counselor, or they called your parents, and et cetera. They did not call the police and have K through 12 children taken to, as Robert Runcie puts it, the jailhouse. No more arrest of children in the K through 12 system for matters that can be handled at school. Commonsense Solutions. And then once again, implementing culturally competent measures in school so that individuals know how to work with children from various races, cultures, and socioeconomic backgrounds. Because what we have to understand is that sometimes people just don't know how to connect with the children, and that lack of connection leads to all kinds of problems. And that also includes linguistic competency, because we do have children in our school systems in the United States who have a great deal of difficulty speaking the English language because they're not necessarily from this country. Perhaps their parents in their homes do not speak English and so forth. And so we also have that barrier that needs to be dealt with. So some of the questions that I want you to ponder is, do you think it is important to address these issues in the classroom setting? And what are your suggestions to eliminate the problem? Because all of us have to put our minds together and begin to think about what to do. What are the reasons for this? Let's go over it and so we can all be very, very clear about it. Private prisons need high incarceration rates, and they need this to meet requirements for contracted private companies. They are businesses that are traded per the New York Stock Exchange. 90 to 100% occupancy is required. That's what they need. And how do they achieve it? With mandatory minimum sentences, with felony plea bargains. Keep in mind that not everyone that is in prison is guilty. Many of the individuals are not able to afford a lawyer, and if they can't, they get a court-appointed lawyer who has so much on his or her plate that they might not be able to give full attention to these cases. So oftentimes individuals, when they're arrested, they're encouraged to plead, and they will plead as guilty, and then they become felons. And once they're felons, their whole lives change in terms of while they're in prison and when they come out. There's also the 3 strikes law. 3 crimes and you're in prison for life. And lastly, what I went over already, the immigration detainment, an arrest made of children in schools, that is the school-to-prison pipeline. This gives these prisons cheap, available labor with significant profits. Private prisons are now advertising themselves as an alternative to the hiring of low-wage workers outside of the country. And you thought corporations were just shipping jobs overseas, perhaps. Companies have found people right here at home who work for as little as 93 cents an hour and cannot strike or take vacation. They're called prisoners. So as documented in my book, the prison workforce is guaranteed. They will not have car problems, they don't need a babysitter, they'll be on time for work, and they're available whenever they need it. They're not paid overtime, they don't receive any kind of benefits, Social Security or pensions, nor are they permitted to form unions or strike. They don't have paid leave, sick time, or otherwise. Their punishment for complaining can be isolation, known as a hole. Approximately 1 million prisoners work for these corporations. And they make as much as $1.25 an hour. What are they doing in there? What are they making? We think we don't have manufacturing going on in this country. They're making military helmets, uniforms, pants, shirts, ammunition belts, and etc. Who are they working for in terms of corporations? Companies that we shop with on the outside. I'm not going to name them all because the list is there and it's also in my book. Starbucks, Nintendo, Victoria's Secret, JCPenney, Sears, Walmart, etc. The source for this information is listed at the bottom of the slide, so you can go there and read a lot more because an author by the name of Chris Hedges has done a lot of work in documenting all of this. In New Jersey, as an example, a prisoner made $1.20 for 8 hours of work in 1980, and today makes $1.30 for a day's labor. On average, they earn $28 a month. And in private prisons, they can earn as little as 17 cents an hour. And so the question that we have to ask ourselves is, well, why do prisoners need money in the first place? They have to pay for their basic commissary items, the toilet paper, shoes, blankets, deodorant, and sometimes for electricity, room and board. They have to take out loans for medication, legal and medical fees, and prison sentencing fees. So when they come out, they're already in debt. And remember, these are felons in many instances who, when they come out, can't find a job. And that's a whole another presentation. But for those who are able to find a job, the money that they owe to the prison will be taken out of their minimal paychecks. So how are they supposed to progress? And that's why the recidivism rates are extremely high, one of the reasons. So corporations run the prison phone systems also with very, very high fees. So money is being made there. So if a prisoner needs to call his or her family or vice versa, money is being made off of those telephone calls. So what is the percent of able-bodied sentenced federal prisoners required to work in the prison? 100%. There's an article posted here from CNN Money pointing out that federal prisoners are stealing our business. Just hearing the word unicorn is enough to make Kurt Wilson see red, it's stated. 13,000 inmates. That is what we are seeing in terms of individuals who are working in these prisons from this one particular example from CNN Money. Please do take a look at that because I think you will find that article very compelling. How do we stop this? What's the solution? My goal with my work is not to just list problems, but for us to get together and find solutions. Stop corporations from using prisoners as cheap labor with little to no pay. This is a sinister form of greed, leading to an increase in corporate profits that can be likened to slavery in form and practice. What are some of the emerging and future concerns around this? Black men are imprisoned in the greatest numbers. So all of the reasons and so forth that I went over previously for this happening, Black men are experiencing it more than anyone else. But also women, poor white people, and Hispanic people of all races and immigrants. And when I speak of Hispanics, remember that Hispanic, according to the Office of Management and Budget of the United States, which is the office that categorizes racial groups in our nation, that organization decided that Hispanic is the only ethnicity and that Hispanic is not a race. This is not my message, I'm just a messenger on this. But Hispanic, a person can be Black Hispanic, white Hispanic, Native American Hispanic, Asian Hispanic. And so therefore, when we look at Hispanic people, we have to break it down by race. And of course, as with anything else, if a person is Black Hispanic or of a darker hue in our nation, they will experience these problems more so than anyone else because of the racial categorization combined with socioeconomic status. So the U.S. Increased its prison population from 1970 to 2005 by approximately 700% per the ACLU, which is unfathomable. Black girls and women in prison. African American girls and young women have fallen through the cracks. They are disproportionately detained and incarcerated by the juvenile justice system. And this is not happening without people in academia and beyond who have a voice recognizing these issues. Sociologist Nicky Jones of UC Santa Barbara, she stated that Black girls are not committing more crimes, even though they're being incarcerated in record numbers. And we also have commentary by Dr. Meta Chesney Lind. I've been studying this for decades, she's pointed out. We've never seen these kind of numbers before. In 2008, we knew the arrest rate in California was 49 of every 1,000 for Black girls, 8.9 per 1,000 for white girls, and 14.9 per 1,000 for Latina. Keeping in mind what I just explained about Hispanics, Latina is another term that is used to describe Hispanic girls. So we can see that there's a fight for girls. We must fight for that. As I come to the end of this discussion, hopefully some dialogue and questions with you, I want to talk about what is known as a vicious cycle in this scenario. We must begin with socioeconomic status. Although racism is a part of this, there is no doubt, and discrimination, it really begins with lower socioeconomic status and marginalized communities, which are largely emerging majority people, and the experience of health disparities that goes along with all of this. There are unjust factors, including food deserts and mirages, supermarkets that are not available for deserts in low-income community. For mirages, they're there, but the people can't afford the food. Poor quality education, health illiteracy, high unemployment, and beyond. And this next item we just covered, school to prison pipeline. The drug war is behind that as part of it. Immigrant detainment and mass incarceration of emerging majority people, locking emerging majority people up and throwing away the key. And we're not seeing them anymore in our midst. We are losing our people. Prison profiteers making money off of this scenario, medical and corporate, private, federal, and state levels, at every level. Prisoner release followed by recidivism because felons can't function in our society. Economic, emotional, spiritual, and overall deprivation, and cultural and linguistic incompetency in our society. This vicious cycle continues if we don't step forward and stop this. So an ideal solution, as I close, is the elimination of unjust, escalating negative factors. Eliminate the drug war. Eliminate the school-to-prison pipeline. Eliminate prison profiteering and end mass incarceration. We also need economic justice and overall social justice, including food justice and cultural and linguistic competency in all areas of health and beyond. And lastly, quality education, employment opportunities, universal health care, and health literacy for all. It is through these steps that we can experience health equity. Although it's ideal, every step toward these types of solutions will make a difference. Thank you all very much.
Great. Thank you so much, Dr. Rose. That was a fantastic presentation. At this point, we're going to give people a chance to ask your questions. And we do have a couple of questions that have come through on the chat box. Dr. Rose, in terms of prison profiteering, what do you think are the key solutions?
Well, it seems that the key solutions in terms of prison profiteering is to end all aspects of corporate participation in the prison scenario. So no manufacturing of items as a primary example for corporations outside of the prison system. It's very hard to believe that this is happening in the first place, but I think that would be a great place to start. If we get rid of the profit incentive in this entire scenario, then I think that would make a difference right away, removing the money out of it. And that would actually end prison profiteering.
Great, thank you. And we have another question come through here. What do you think has caused the increase in for-profit prisons?
What has caused the increase is the desire to well, there's a number of factors, but I'm going to talk about the profit still, since we're using the term prison profiteering. There's the desire to have low-wage workers. It's a form of slavery. And it sounds so harsh to say that, but it's actually very true. We are on the outside having this fight and discussion about increasing minimum wage and so on and so forth, and that is a very valid argument that we all understand and appreciate. But while that's going on, at the same time, we have individuals that are inside of prison systems that are actually manufacturing and not getting paid, or getting paid so low that it's negligible to do this kind of work. So I think that's the answer to that question.
Great, thank you. Got a lot of very thoughtful comments and questions coming through here on both the chat box and the Q&A. Someone has said thank you so much for a wonderful presentation. Could you talk a little bit about trauma-informed care? Is this something you discuss in any of your books in order to address some of these issues?
Well, I want to make sure that I'm understanding. So in trauma-informed care, this is not a term that I use per se in my book. So I would need clarification so that I make sure that I'm answering that correctly. So is there any way that we can get clarification on the terminology?
For the person who wrote the question, if you wouldn't mind clarifying what you mean by trauma-informed care, and then in the meantime, we'll move on to a different question. All right, here is the question for you, Dr. Rose. How can public health strategies be used to eliminate specific lack of basic medical care?
Public health strategies are, first of all, necessary in terms of understanding what's happening. I think that we can begin in the classroom. So students today should be experiencing course materials in public health in which they are informed about mass incarceration, prison profiteering, and the lack of adequate care that individuals are receiving in prison. So the first is information. Secondly, we need to look at this as a public health crisis, because mass incarceration is actually a public health issue. The reason why is because it is breaking up families. It is literally destroying families. So when you have the mother and the father, or one of those individuals that are key to the family, locked up for life or for very significant periods of time, that impacts the entire family's livelihood. And so invariably, when there's a lack of support and resources in a family, this inevitably will lead to health issues. So it's a very comprehensive approach that public health would have to take, but the first thing I believe we must do is become aware, which is why I wrote this book. Although my book is not solely about mass incarceration and prison profiteering, it's a very significant aspect of the detail, because it is contributing to the overall health disparities. And so if we don't discuss this as part of public health, we're not going to be able to solve the problem. So I think that's where we have to begin. Awareness, and then adding it to our curriculum, and then subsequently making sure that it's part of our overall public health efforts toward resolution.
Great, thank you. Got a lot of questions coming through, which I will try my best to plow through and get to everyone's questions. Let's see, what is the rationale behind why Black girls are disproportionately suspended or arrested?
That's an excellent question. So the bottom line is that it's racism. And I know that doesn't sound like a sufficient answer when you think about it. But if you look at the work of the two professors that I referred to in the material, in the PowerPoint presentation, as well as in my book, the bottom line is that there is a lack of cultural competency oftentimes in serving youth of color. Many of the individuals that are arrested are from lower socioeconomic communities. The teachers that come in to serve the children in schools are not from the neighborhoods where they are teaching, and they don't look like the children that they're serving in terms of race. They don't understand some of the issues that the children are experiencing in terms of socioeconomic status. Many are experiencing rage, they're experiencing fear, they may not be as verbal as the teacher feels that they need to be in terms of expressing themselves, all kinds of dynamics that take place in the classroom. And consequently, this can lead to children maybe acting out in such a way that in the past would have sent a child to the principal's office or to the guidance counselor to help them sort out their issues. But rather than that, if they get into an argument or, you know, maybe a fight or something, they will suspend them right away. And they suspend the black girls at a higher rate when compared to white girls. Black boys are suspended the most. And so that is the reason behind it. And so it has to do with socioeconomic status, and it also has to do with race and discrimination and just the inequities that are existing within the school system.
Thank you. Okay, let's see. We have another question here. What can be done to increase the rehabilitation offered to individuals who are incarcerated beyond vocational work?
Well, we have to look at this from a very multifocal approach, because we cannot assume, first of all, that everyone that is in prison in these outrageous numbers, that they're guilty and that they need to be rehabilitated. There's some horrible stories that exist. I wish I had time to talk about them, but unfortunately, time doesn't permit. But there are so many cases of individuals who are in prison for very, very minor infractions. Maybe they had, you know, a small bag of marijuana on them and they got arrested during a stop and frisk situation. They're not addicts or anything to that effect. And other crimes that are not very, very serious. And they are brought into the system and they're put into a situation where they have to plead, and they might plead to a higher charge, and then consequently they end up getting this brand of a felon that puts them in a position where they can't get jobs, and it goes on and on and on. Or they might end up in prison if they opt not to plead and they go before a jury and they end up becoming incarcerated for a very long period of time. So in those cases, there's no rehabilitation that's needed necessarily. What is needed is to stop incarcerating people for unjust reasons. For those people who have a serious problem, maybe it's drug addiction and they're in prison and they have committed crimes and so forth, that is the nature and purpose of a prison, to rehabilitate individuals, to try to get them ready to come back into the society where they were pulled from and placed in prison so that they can function. So I think that rehabilitation should be at the forefront of every prison, not profit, not using them to make products for us to buy on the outside for our enjoyment. But you have done something wrong, whatever it is. Now you're in here with us, and there's a penal aspect to this, but at the same time, we are going to help you and prepare you to go back into society, not lock you up and throw away the key.
Great, thank you, Dr. Rose. And we do have a response on the meeting of trauma-informed care. Trauma-informed care is a way to understand the effects of trauma, e.g. neurological, biological, psychological, and social, and the prevalence of these experiences as people are seeking care. Some people have thought this model could be used in other domains of healthcare delivery.
Well, I think that trauma-informed care, from that vantage point and with that explanation, would definitely be part of the solution. Because I think that if we look at solitary confinement as a very specific example, when a person is placed in solitary confinement, as I discussed, that in itself is trauma. It leads to all kinds of psychological and psychiatric issues and so forth. That is very well documented and that is understood. So individuals who are working inside of the prison system must understand all aspects of trauma, from the neurological vantage point, from the psychological, psychiatric vantage point, from the drug-induced vantage point, and we could go on forever. Because I have visited prisons, I've taken a look at what's going on inside, and I understand that the entire experience is deeply traumatic. And to be inside of such a scenario for a very significant portion of your life, or even for a short term, it goes without saying that trauma-informed care would have to be an integral part of the process of rehabilitating and helping individuals who need it.
Great, thank you. Let's see, Dr. Rose, what % of prisoners are in for-profit versus government-run prisons? Which states have the highest rates? And then another question from someone else related to that, how do you have government oversight in prisons run by private corporations?
How do you, well, the government can oversee and provide regulations for prisons to make sure that the prisons are doing what they are supposed to do. The government provides oversight for basically everything in our society in terms of corporations. We have bank oversight right now, and that's another discussion that I can't really get into because of time. But the government can provide regulations and rules that must be followed with penalties for these private corporations that are involved in these processes. In terms of specific numbers as to private versus state and government prison scenarios, I would recommend that you take a look at my book, because in the book I have numbers and information, but I also have sources pertaining to those specific numbers, so that if you don't find the exact numbers that you're looking for, the references in the back of each chapter provide you with more sources that you can go to and take a look at. I would also direct you to, in the PowerPoint presentation, the NAACP report that I talked about, Misplaced Priorities. In that particular article, the NAACP delineates the state breakdown of money and how it's allocated and how more money is going toward prisons than it is to actually going to K-12 schools. So I would take a look at all of those things to make sure that you get accurate and up-to-date numbers so that you can see the actual physical breakdown in terms of who is doing what to whom in the prison system.
Great, thank you. And actually, as you mentioned that, a question related to that, are you able to identify what types of political activism might help move the funneling of monies from our taxes going to private prisons and back into improving our children's education?
Well, I do want to say, because I know that there is a tendency, so I'm going to answer this question in a two-pronged way. There is a tendency to separate the private prisons from the public prisons, as if to say it's the private prisons that are doing such a terrible thing and we need to stop them, and then to ignore what's going on with the public prisons. I hope that isn't misconstrued, because if you go back to the numbers that I provided and the manufacturing and some of the other things that are going on, the workers making military items and et cetera, it's going on, what I'm describing, prison profiteering in the state and the public prisons as well as the private prisons. So I hope everyone is understanding that, because not only the private system that's the culprit, even though they are making the lion's share of the profit, it's also the public system as well. In terms of activism, there's a lot of activism going on, and that makes me really excited. So there's a lawyer, her name is Michelle Alexander, and she wrote a book called The New Jim Crow. And I actually taught a course. I developed a course around her book. And the reason why is because she is talking about this whole notion of activism. It is her work that led me to this new work, my own book. And that led me to write a significant amount of detail in my book about mass incarceration and prison profiteering and et cetera. So I think that one approach to activism is to get out there and to make sure that people know that this is happening. If you're involved with organizations, you know, churches in your community, nonprofit, profit organizations, it doesn't matter. These kinds of books, my book has the information that's needed. Listen to talks, webinars, everything that you can, organize around it. But the bottom line is that we have to get the word out. And the more that we get the word out, because many people do not know that it's happening. People were shocked when they heard John Legend and Common make these comments at the Oscars in 2016. The more people know, the more we are stepping up and moving toward activism. So that would be the approach that I would suggest that you take. Get informed first, find out what organizations are already doing things about it, join up, and if you can't find an organization that's doing it, start it yourself. And stay connected with me because I'm in it for the duration.
Great, thank you, Dr. Rose. And we do have a couple more questions kind of on a similar note, many questions about how do we change people's mindset. For example, I have a question here, how do we treat healthcare in prison as a human right in a U.S. system which does not view healthcare as a human right, but a service that can be traded for profit? That's one question. We have another. Several years ago, we had protests over giving prisoners the flu vaccine because people felt that the prisoners should get punished, in scare quotes, and didn't deserve the flu vaccine. How do you change that mindset?
Well, that type of mindset is at the forefront of the problem, and I think that's what we have to do. Healthcare in this country, because it is a profit-based scenario, not just for prisoners, but on the outside for everyone, and it's not viewed as a human right. And I agree with that statement, but that has to be changed. That mindset has to be changed. We are the only industrialized nation in the world that does not have universal health care. We don't have universal health care. We didn't have it before Obamacare. We don't have it now with Obamacare. And it doesn't look like we're going in that direction after Obamacare, and that's the problem. So minds have to be changed to understand that it's a human right. And for prisoners, it has to be understood that just because you become a prisoner does not mean that you lose your humanity. You are still a human being and should be treated as such. So that is part of the advocacy in terms of mass incarceration, to help people to understand that what we are having a conversation about is not just this abstract entity called a prisoner, but we are talking about human beings. And human beings have the right to be treated with dignity, and they have the right to be treated with care, especially in terms of health. And the fact that the flu vaccine or anything is being used to punish a human being, and this is going to be from my personal vantage point, I feel that that is inhumane, it's cruel, and it's deplorable, and it's unacceptable. And as public health practitioners, as doctors, and other clinicians that are practicing in the field, we have an obligation to speak against dehumanizing acts against human beings. We chose this field of public health and beyond because we care. We have to express our thoughts about it and make it clear that that mindset has to be changed. I'm doing it through my book, and I suggest to people that with whatever venue you are working from, you should be doing it also because human beings matter, whether they're in prison or not.
Thank you, Dr. Rose. Very well said. And I think there are some more questions, many with very similar themes. I think at this point, because we're getting close to the top of the hour, I do want to start to wrap things up. Certainly, if you have more questions, I welcome you to reach out to me, and I can pass your questions on to Dr. Rose. Before we wrap up, I did want to give you a little bit of information about Dr. Rose's new book, which just published earlier this month, titled Health Disparities, Diversity and Inclusion, Context, Controversies, and Solutions. That book is available on our website. If you go to go.jblearning.com/Rose, you can find information about the book, how to request an instructor's copy if you'd like, or see sample chapters, or get access to instructor materials. You can, of course, buy the book as well if you'd like. And the topic of mass incarceration, as Dr. Rose mentioned, is woven throughout the book. But the book is a much broader treatment of the health disparities that continue to exist in American society. It addresses the topic head-on, and it explores steps that must be taken to prepare for the rapidly changing demographics in American society, including immigration reform, evidence-based information, substantiating the fact that diversity matters in terms of the provision of health care. Diversity is examined in terms of patient satisfaction and quality outcomes, with an emphasis on racial, ethnic, gender, and linguistic diversity. And then importantly, the book highlights steps that key stakeholders, including federal, state, and private healthcare and public health entities, should take to ensure that representatives from emerging majority groups are involved with and serve as leaders in terms of the provision of healthcare at every level. Something to consider as a course resource if you are teaching a course on health disparities, diversity, cultural competency, and as I said, we are offering complimentary instructor review copies. As I mentioned before, the entire session has been recorded and will be posted on the Public Health and Health Administration faculty group. If you're not a member already of this faculty group, I encourage you to join. It's a LinkedIn group, and you can get there at go.jblearning.com/th-LinkedIn. That's where the recording will be posted. So a very special thank you to you, Dr. Rose, for your excellent presentation today.
Thank you very much. It was my pleasure, and I hope that the information I provided today was helpful to understanding mass incarceration.
Thank you again to everyone for your participation, as well as all your thoughtful comments and questions. And with that, I'm going to go ahead and ask Angel, our operator, to go ahead and close out the audio line. Thanks again.